Okay, hi. We're about to do our interview. So, Miss Trish, what is the name of your organization?
I work for Mayo Clinic here in Jacksonville.
Okay. And what is your title at Mayo Clinic?
My title is Clinical Data Specialist in the Blood and Marrow Transplant Department.
Okay. So, how would you describe your typical day or week on the job?
Well, to start with, what I do is report on a patient from prior to bone marrow transplant for as long as they live.
Mm-hmm.
So
Wow.
we report to an organization called the Center for International Blood and Marrow Transplant Research, CIBMTR, and they send us a list of forms every 4 months, and those are the ones we go through. So the typical day would be to come in, bring up the list of forms, choose one to start with, go into the patient's electronic medical record with Mayo, see if they've been here recently. If they have, go through their records, abstract the medical data that we need to complete the forms, submit the form, and move on to the next patient. If we don't have the records in our system, then I have to contact their outside physician or sometimes the patient themselves to get them to tell me who they're seeing now, or to get the outside provider to send records. Awesome. And then after that, it's the same process. Just go through, abstract the important information out, and submit the form.
Awesome. Okay. How did you get into this field?
I really lucked into it. Had no idea what it was when I saw it listed. I was already working at Mayo. Mm-hmm. And at the time, the job was listed as kind of a very low-level data entry type of job. The people who had created the job description didn't understand how involved it was.
Yeah.
So so I had enough background to qualify for it, and some experience with entering data and creating databases. And then a coworker and I got the job reclassified to a much higher level, so it's more appropriate for the work that we do.
Definitely just sounds like a lot of work. So which majors are most successful with securing employment in this field?
It's an allied health job, which just means that it doesn't have really a strong, definite medical component to it. However, my coworker that was just hired is an RN. They decided to bring in some more medical knowledge because I don't have that background.
Right.
So a major in clinical research or any kind of the medical field would be useful.
Right. Okay. Would any other majors be helpful, like maybe like a communications background or something like that?
Probably not communications. Health administration would be helpful. Any computer background could be helpful as well.
Okay. I can see that. That's awesome. What is the most satisfying aspect of your job?
Because my job doesn't involve working with patients directly, except for the occasional phone call to speak with them, it's just really the knowledge that what we're doing by submitting these forms, all this information is going into a massive database at the CIBMTR. Physicians and other researchers and scientists have access to that data, and they can take that and develop better treatments and create better outcomes for the patients who need these transplants. Besides that, working in the field itself, when I have the opportunity to see, whether it's online or at a conference, a donor and recipient meeting, that's really satisfying, just to know that you're a part of saving somebody's life.
Right. Wow. That's awesome. That definitely relates to working in nonprofits.
Right.
What percentage of your time is spent using computers? We kind of already talked about that.
But. Yeah, it's a huge amount. Most of what I do is on the computer, 95%. Occasionally, I will have to go to the physicians themselves if the information I need isn't there. I have to go to them and try to get the information that I need, or the nurse coordinators in the department.
Okay. Awesome. Now, do you have any special advice that you would give a young person entering, maybe in just nonprofits in general, or to Mayo Clinic, or anything like that?
Um,
Just advice for career.
I think it's important to learn how to be a self-starter and to be able to work independently, to develop those skills and to be able to show them when you're applying or meeting with these organizations. Other than that,
Yeah, that's great. Awesome. Well, thank you so much, Miss Trish, for interviewing.
you're welcome.
Yay!